Hello, my name is Rob Squatrito. I'm a gynecologic oncologist. And what I'd like to do is give you a sense of what it's like to come to this office for a consultation, and hopefully this will make your visit a little bit easier. First of all, there are three of us. There are three physicians in the GYN oncology team. We have 2 physician assistants, we have 2 nurse practitioners, we have several nurses, medical assistants, we have a scribe that may be in the room taking notes while you're here. So it's a big team, all working toward the same goal. There are several reasons that people are referred here. When the word oncology is used, there's always a little bit of panic about the cancer word, but some people in fact are referred here for benign conditions, complicated benign conditions that may require surgery, not necessarily referred for cancer. Some people are referred for things that are suspicious that might be cancer, a growth or a mass that has not yet been proven to be cancer but has some suspicion, and they come to us. And then there are people who have had biopsy-proven cancer. They already know that, their doctor told them they have cancer, and they are referred to us. So those are the reasons that people might come here, and we find that when people get here, we're actually often clarifying for them the reason that they were referred once we go through all of the records. When you get here, the receptionist will greet you. You'll be placed in a room by a medical assistant, and they'll do the routine things like ask you some questions and take your vital signs. There will be a packet of information that you will either have filled out before you arrive, or they'll ask you to fill it out when you arrive, and this gives us all the background of your past health history, which is important to us. You'll meet with one of the physicians in an office like this. Sometimes that's done initially when you arrive, sometimes it's done after exam, but there will be a significant portion of your visit where you'll sit down face-to-face with the physician. There may be a nurse or a scribe in the room at the same time, and talk over all the details of why you were referred here and what we need to do about the problem that you have. There will almost certainly be a full exam done at some point during the visit. Well, you'll be in an exam room and maybe have a complete head-to-toe exam. Often a pelvic exam will be part of the exam, depending on why you were referred. And after all the consultation, the talking is done, and after all the exam is done, you'll have a sense of what is the nature of the problem and what needs to be done about it. And we'll begin scheduling and planning out the treatment for you. If surgery is required, you'll be given a surgical time and date while you're here at that visit. And occasionally we're planning things like radiation therapy or chemotherapy, and we would explain that and plan that for you as well. So that's pretty much what the visit consists of. You'll probably be here for about an hour with all the things that have to be done, and hopefully when we're done you'll have a good sense of what the nature of the problem is and what we can do to take care of it for you. And it's a team approach. You'll meet several of the team while you're here, and you'll get resources, people to call with problems. You'll get phone numbers of different individuals on the team, and hopefully leave with some clarity about what needs to be done and how it will be done.